Hello and welcome to the Malaria Notebook with me, Liliana Dayo. Today, we are going to learn about the increasing burden of malaria in school-age children and adolescents in Africa. Welcome. As you may be aware, malaria remains a major public health challenge in many parts of Africa. Traditionally, we have been focusing on children below the age of 5 and pregnant women. However, recent evidence shows a shifting burden toward school-age children and adolescents. Why are adolescents increasingly getting affected? Some of the reports indicate incomplete immunity from early childhood exposure to older age. Also, it is reported that adolescents spend more time outdoors during evening hours when mosquitoes are active. There are also reports on limited use of insecticide-treated nets, commonly referred to as ITNs, among older children and teens due to cultural barriers and limited sleeping spaces reported in many homes in Africa. So the table on the screen shows a comparison on the burden of malaria among adolescents in different parts of Africa. In a study done in Kenya, amongst children between the age of 6 months to 14 years, indicated that the 10 to 14-year-old had higher prevalence of 10% compared to 4%, which was among those who were younger. In Malawi, there was a reported prevalence of 31% of malaria among school-age children compared to 14% in the younger children. In Nigeria, 24.1% asymptomatic infections linked to anemia and absenteeism was among the 5 to 12-year-olds. Similarly, in Uganda, up to 40% prevalence was reported amongst the 6 to 14-year-old children. Ghana, Tanzania, and Ethiopia do also report a similar trend of high malaria burden amongst children aged between 5 to 19-year-old. So what are some of the implications for health and education? Repeated malaria episodes contribute to anemia and poor academic performance amongst the school-going age. It also leads to absenteeism, which disrupts learning continuity. And also important to note is that female adolescents are more vulnerable to malaria due to early pregnancies, which is accompanied by malaria in pregnancy, anemia, and also limited access to preventive services as a result of the stigma associated with malaria in pregnancy in the teenagers. So what are some of the strategies we can use to address the burden of malaria amongst adolescents? One of the things we can do is to integrate malaria education in school health programs. Also, we can extend ITN distribution to schools and adolescents. We can also advocate for promotion of seasonal malaria chemo prevention interventions up to the age of 15 years in high transmission zones. Important also to strengthen surveillance and age disaggregated data reporting in all the high malaria transmission places. So let's see what we know. Are school-age children increasingly carrying the burden of malaria in Africa? The school-age children often carry asymptomatic malaria infections. Are female adolescents at a higher risk of malaria due to early pregnancies and anemia? And can school-based interventions such as IPTSC help reduce malaria among school-age children? Do school-age children contribute significantly to ongoing malaria transmission in their communities? And lastly, does malaria in school-age children affect their school attendance and learning? In conclusion, the shifting malaria burden to adolescents signals a need for tailored interventions targeting this group of this cohort of population, and schools offer a critical entry point for prevention, diagnosis, and health education. Lastly, addressing this group can close the gap in malaria elimination efforts across Africa. Thank you for listening. Let's keep subscribing for more lessons from the Malaria Notebook. Let's fight malaria one lesson at a time. Thank you.